Welcome to the third video in our medical terminology series. In this video, we're going to be looking at medical abbreviations and shorthand. In both the basic life support patient care standards as well as the advanced life support patient care standards, they have a list of commonly used abbreviations. So in the BLS standard, you can find that on page 4. In the ALS standard, you can find that on page 11. And so when we are documenting, we will sometimes use shorthand in order to increase the efficiency and sometimes even save space within our documentation. So one example of that is the letter C with a line above it. That refers to width. If we have a change that we want to document, we can use a triangle to represent change. If you want to indicate that something needs to be multiplied by a particular number, then you can use the X or times symbol. A question mark can be used to indicate something that is questionable or possible. So, for example, perhaps you have a patient where you highly suspect that they have a fracture. Of course, as paramedics, we are not going to be able to x-ray that area of the body in the field to determine if there is a fracture and actually diagnose that. So we would be indicating that it is a possible fracture. So that's an example of where we could use that question mark to show that. There is also a shorthand for fracture, which is the hashtag or the number symbol. So if you wanted to indicate a possible fracture, you could actually put question mark hashtag. And then of course you would want to expand your documentation to indicate, where you thought that fracture was. So there would be more to the documentation than that. But that is an example of how we can use that question mark in our medical shorthand. Many of you, of course, will already be familiar with the less than and greater than symbols, so we do use these in our documentation. You'll also see these being used in your medical directives and sometimes in the standards. Similarly, we have the symbol for not equal to, which is the equal sign with a line through it. We've also got a symbol for equal to approximately. And so if you look at what's over here, what I'm trying to represent there is an equal sign with a squiggly line above it. So you may notice that on this slide, the squiggly line is actually sort of aiming up towards this top corner of the slide. And so when we write equal to approximately, it is not necessary to angle it like that. It's just simply the only way I was able to get it on this particular slide. So it's actually a equal sign with a squiggly line running above it, okay? So next we're going to look at some ways to abbreviate some commonly used words in medicine. So if you have a capital T followed by a lowercase x, that refers to treatment. Similarly, a capital R followed by a lowercase x refers to medication. A capital D followed by a lowercase x refers to a diagnosis. A capital F followed by a lowercase x refers to a fracture. And remember again that we can also use that hashtag or number symbol to show a fracture. Capital D followed by a lowercase x refers to a differential diagnosis. Similarly, we've got that diagnosis, which is just the DX, right? So we've added the extra D to represent the fact that it is differential diagnosis. Now what we're going to do is we're going to look at just a series of different abbreviations and a little bit of shorthand that comes up frequently for paramedics. So the first one we're going to talk about is ASA, which refers to aspirin, otherwise known as acetylsalicylic acid. BPM refers to beats per minute. BVM refers to a bag valve mask. So this one, again, likely familiar to most of you at this stage. C/O means complains of. CABG, all capitals, refers to coronary artery bypass graft. CNO means cannot obtain. So if for any reason you are documenting that you could not obtain a piece of information that would typically be required in a particular circumstance or be relevant in that circumstance, it will be super important that you're documenting why. So anytime you are using CNO in your documentation, consider whether or not you have indicated why you were unable to obtain that information. CPAP. CPAP refers to continuous positive airway pressure. COPD refers to chronic obstructive pulmonary disease. CPSO refers to the College of Physicians and Surgeons of Ontario. C-spine refers to the cervical spine. A CVA is a cerebrovascular accident, otherwise known as a stroke. D/C means discontinue. DKA refers to diabetic ketoacidosis. DVT refers to deep vein thrombosis. ETCO2 refers to end-tidal carbon monoxide. ETOH, alcohol. And ETT, endotracheal tube. FiO2 refers to the fraction of inspired oxygen. FRI refers to a febrile respiratory infection. GCS refers to the Glasgow Coma Scale. HTN refers to hypertension. HR, heart rate. A capital J refers to joule. Capital K refers to potassium. Capital KCl referring to potassium chloride. LOA refers to level of awareness. LOC, level of consciousness. LLQ refers to the left lower quadrant, or the LUQ can refer to the left upper quadrant. So you can use this when you are referring to the body cavities that we looked at in our second video. So for example, you may have a patient that is complaining of pain in the left lower quadrant of their abdomen. So then you can use the LLQ. Of course, when we're talking about documentation, we would be expanding on that pain. We would be providing more information about what the pain felt like. And these are things that we'll discuss in subsequent classes. MOH-LTC refers to the Ministry of Health and Long-Term Care. Capital N, lowercase a, refers to sodium. Capital N, lowercase a, capital C, capital L refers to sodium chloride. N/A means not applicable. NPO means nothing by mouth. NSAID, non-steroidal anti-inflammatory drug. PRN means as needed. So you'll often see this with medication instructions. So for example, you may have a patient who is prescribed nitroglycerin that they are to take when they are experiencing chest pain. So the patient may not be taking that medication regularly as a prophylactic or a preventative, but rather they're taking it as needed when that chest pain occurs. So that's an example of a PRN dosing. PPV refers to positive pressure ventilation. PCI, percutaneous coronary intervention. RA, rheumatoid arthritis. RR, respiratory rate. R/O means rule out. RLQ refers to the right lower quadrant, so similar to the ones that we were looking at for the left lower quadrant earlier, right? The LLQ. ROSC means return of spontaneous circulation. RUQ, as you can likely guess at this stage, refers to the right upper quadrant. SpO2 refers to the saturation of peripheral oxygen. STEMI, STEMI, refers to an ST segment elevation myocardial infarction. So a heart attack that is presenting with elevation of the ST segment in the ECG tracing in that 12 lead. SBP refers to systolic blood pressure. SMR refers to spinal motion restriction. SDM refers to substitute decision maker. SOB refers to shortness of breath. TOR refers to termination of resuscitation. Now, you can also add a letter at the beginning to show what kind of termination of resuscitation it is. So if a T appears at the beginning, so a T-TOR, then that indicates that it is a trauma termination of resuscitation. Similarly, if there is an M-TOR, then that is referring to a medical termination of resuscitation. TBI refers to a traumatic brain injury. TCA refers to tricyclic antidepressant. TCP refers to a procedure called transcutaneous pacing. URTI is an upper respiratory tract infection. VSA means vital signs absent, which, we can translate that into plain language to mean that someone is dead, right? WNL, within normal limits. So now we're just going to change tracks a little bit and look at some shortened forms for electrical activity in the heart. So this is not a fully inclusive list, but this will give you an idea of some of the common ones and some of the ones that you'll likely be learning first. So as you learn more about the different heart rhythms, then you will learn more of these shortened forms as well. So as you guys are already aware, right, the ECG refers to the electrocardiogram. This is a great opportunity if you'd like to pause the video for a moment and see if you can break this word down into its different components. See if you can find the combining forms, see if you can identify, the meaning and the meaning of all of those individual component parts, okay? So that, like I said, is a great opportunity to just practice those skills that you learned in the previous videos. NSR refers to normal sinus rhythm. PEA, pulseless electrical activity. VF refers to ventricular fibrillation. And VT refers to ventricular tachycardia. Next, we're going to move on to looking at dosing schedules for different medication. So you may see these dosing schedules listed on your patient's medication labels. You may see it on patient's charts if you're looking at paperwork, during interfacility transfers, or sometimes when you're receiving patients from AIR, there may be patient charts. And also then you can utilize this in your own documentation in the medication area. So BID refers to a twice daily, HS at bedtime, PRN refers to as needed, right? So remember we saw that one on a previous slide, but since it's associated with a dosing schedule, we're just reviewing it again here. Q refers to every or each. So in this example here, the D refers to day. And the Q is each day, right? Or every day. So QD stands for each day or every day. QID, 4 times per day. Q2H, every 2 hours. Q3H, every 3 hours. And without me telling you, I bet you can all fill in Q4H, right? So of course, that's every 4 hours. So I think you guys are getting this pattern here. QOD refers to every other day. QPM refers to each evening. TID, 3 times daily. Next, we're going to look at different routes of administration for drugs. So an MDI is a metered dose inhaler. Again, if we want to sort of translate this into plain language, this is what people think of as puffers, right? And so you will, as paramedics, be involved in administering metered dose inhaler medications. So you'll have some instruction in that in your lab classes and patient care theory classes. Sublingual is SL. SQ refers to the subcutaneous route. IM, intramuscular. ET, endotracheal. Remember, we saw earlier that ETT refers to the endotracheal tube, right? So in this case, we've just dropped that extra T, and therefore we've dropped the word tube from it. TOP refers to topical. PO otherwise known as per os, so you may see it written either way, means by mouth. IV, intravenous. IN, intranasal. IO, intraosseous. And NEB or NEB refers to nebulized medication. So we also need to be familiar with units of measurement in pre-hospital care. And so many of you, of course, will be familiar with some of the terms on the slide. We're just going to go through them because I have no doubt that there are a couple here that are new, and this will also provide us with a refresher because we may not have thought about some of these things for a little while. So centimeters, I'm sure that all of you are familiar with, right? We write that as a lowercase cm. Drops. Drops, we can write that as GTTS. And so you'll see GTTS on IV tube packaging. So it's showing you the drops per minute of that particular IV set. You'll also see it in orders for how IVs are going to be run. So the rate that IVs will be running at. So that will come up for you guys in the future. Of course, HR, lowercase hr refers to hour. Kg, kilogram. Micrograms. Micrograms can be written one of two ways. So it may be UCG or it may be MCG. Okay, so both of those do refer to micrograms. Mg refers to milligrams. ML refers to milliliters. MMOL refers to millimoles. ml/kg, as you can likely guess, milliliters per kilogram. G refers to grams. MM with a capital H and a lowercase g refers to millimeters of mercury. Capital L refers to liters. KM refers to kilometers, and we'll be recording our vehicle kilometers on our ambulance call reports. MEQ refers to milliequivalent. So now what we're going to do is we're going to actually do a little exercise here where you'll be able to try and put into practice what you've just learned. So what I would like you to do is get a pen and a piece of paper handy. And I would like you to try and write out the 3 examples that we have on the slide using plain language. So anywhere you see a symbol or a shortened form, please try and write that out fully, okay? So go ahead, get that paper, get that pen, pause the video, and give all 3 of these a try. So hopefully you found that you were able to work through those 3 examples. We're going to go through the expanded version of each now. So the first one, written up at the top of the screen here, that means the patient was diagnosed with chronic obstructive pulmonary disease and has a history of ST elevation myocardial infarction in 2009 and a coronary artery bypass graft in 2010. Okay. So the next one, the translation for this is that the medication includes sublingual nitroglycerin, 0.4, and actually I should have written out milligrams there, right, for you, as needed for chest pain. Oral aspirin, 180 milligrams each day. Or you may recall that we have 2 different names for aspirin, right? So you may have chosen to write oral acetylsalicylic acid, 180 milligrams each day. And so both of those, of course, would be correct. So moving forward into our third example, the third example translates into change to chest pain following 1 dose of self-administered sublingual nitroglycerin from 8 on 10 to 3 on 10 on the pain scale. So hopefully this presentation has provided you with some tools to enhance your documentation. Please, if you have any questions, feel free to email me.